Perfect, so now I'm going to do the first portion of my head to toe exam. First, I'm going to start by assessing the skin. His color is appropriate for race, no pigmentation changes. I don't see any lesions, no bruising, no moles, no tattoos, no piercing, and I would also inspect the vascularity. If there was any moles or lesions, I would do the A, B, C, D, and E. Next, I'm going to palpate the skin. It is warm and dry to touch. It is smooth. The hair is evenly distributed on it. I'm also going to check skin turgor, and that is good. Next, I'm going to look at his head. His hair is light brown. It is evenly distributed, as well as the hair on the rest of his body is evenly distributed. Next, I'm going to look at his fingers and nails. His nails are rounded. They are smooth. There's no clubbing noted, no pitting, and there's no nail and hand deformities. Next, I'm going to move on to the face. I am going to look at the symmetry of the facial features. I'm also going to look at the scalp, looking for any edema. No edema noted. Face is symmetrical. It is normocephalic, atraumatic. Next, I'm going to palpate. So I'm just going to palpate the skin and then the facial features. No visible, palpable lesions, masses, scarring, or depressions. Like I said, no swelling noted on palpation. Next, I'm going to inspect the temporal arteries. And those are both 2+ bilaterally. Next, I'm going to check the TMJ. I'm going to just have you open and close your mouth. No clicking noted. And then I'm going to palpate the frontal and the maxillary sinuses. No pain or tenderness noted with the palpation. Next, I'm going to move on to the ears. I am going to note the placement. They are symmetrical. They are bilateral in size, or the shape is equal bilaterally. And I'm going to look, no discharge coming from the ears, no lesions on the ears. Next, I'm going to look into, or I'm going to palpate first, and I'm going to palpate the auricle, the helix, the tragus, and then the mastoid. Next, I'm going to look into the ears. I'm going to look into them bilaterally. I'm going to pull that pinna up and back. Perfect. And the canals are free of sternum, discharge, and lesions. There's no erythema noted, no perforations noted in that TMs. The TMs are pearly gray, and with a positive light reflex. The cone of light on the left side is at that 7 o'clock position. The cone of light on that right side is in the 5 o'clock position. I'm able to visualize the umbo, the malleus, the long handle, and the rim. And then if they were 3 and younger, I would pull that pinna down and back. Next, I'm going to inspect the eyes. I'm going to look at those eyebrows and eyelashes. They are symmetrical. The hair is evenly distributed. Next, I'm going to look at the eyelids and upper and lower. I'm going to lift those eyelids and look at the conjunctiva. It is pink and moist. I'm going to look at the sclera. It is white, no jaundice noted. Next, I'm going to look at the pupils. For symmetry and size, they are equal and round, and that iris is blue. Next, I'm going to take my fundoscope and I'm going to look at the eyes, and I'm just going to bring it in. And then I'm going to do the other side. Perfect. And so that that red reflex is present. That optic disc has sharp margins. The blood vessels are no abnormalities. There's no crossing or anything like that. That retinal background is an orange-black color, or an red-orange color, and there's no exudate or hemorrhages noted in there. That macula is about 2.5 discs away from that optic disc, and there's no lesions, nicking, pulsations, or papilledema noted. I also would do, if I didn't do it, I would do the perlas. But I would do that with the cranial nerves. But the pupils are round reactive. The pupils are equal round reactive to light and accommodation. They are direct and consensual. They constrict appropriately. And then I would do convergence. So I'd have you look at my finger. And they converge on the axis. Next, I'm going to look at the nose. I'm going to inspect it and I'm going to palpate it. No pain or tenderness with palpitation. No lesions noted. The nose is symmetrical. Next, I'm going to inspect that nostril, the nostrils, and the septum is midline. There is no polyps or edema. The turbinates and the nasal mucosa are pink and moist. And there's no discharge or exudate noted. And then I'm going to do the sniff test. So I'm just going to cover one nostril and have you sniff it. And then do the other side. Perfect. And his nares are patent. Next, I'm going to move on to the mouth and the pharynx. I'm going to first look at those lips. They are pink and moist, no cracking, no dryness noted. Next, I'm just going to look into your mouth here. Perfect. His teeth have good dentation, no canaries, no broken teeth noted. Gums and oral mucosa are pink and moist. There is no bleeding, no sores noted. The tongue is pink. I'm also going to have you lift that tongue up so I can inspect under it. Perfect. No lesions noted under that tongue. And Wharton submaxillary duct is patent. Also, the parotid duct on the sides of the mouth are also patent. And that palate is pink. The uvula is pink. The tongue is pink. That uvula rises midline. And so if I was going to palpate the oral structures of the mouth, I would put a glove on and palpate the oral structures. For the salivary glands, I would palpate the lateral sides of the mouth, lateral walls of the mouth and underneath the tongue. And then for the tongue, I would grip the tongue, the tip of the tongue, and move it side to side. Also, his breath is odorless, and his tonsils are 2+ bilaterally. That meaning that they're halfway in between the tonsil pillars and that uvula. Next, I'm going to inspect the neck here. I'm looking for symmetry. It is symmetrical. That trachea is midline. There are no masses, no lesions noted on that neck. If there was any masses noted, I would take note of the size, the shape, and the mobility of those. I don't see any scars or pulsations noted. Next, I'm going to palpate the lymph nodes. So I got the preauricular, postauricular, occipital, submandibular, submental, post-cervical, anterior cervical, supraclavicular, and infraclavicular. Next, I'm going to palpate the thyroid. So I'm going to go behind the patient, and I'm just going to palpate. I'm going to have you take a swallow. Okay, and then the other way. Perfect. And that thyroid is smooth. It is small and it's free of nodules, no tenderness, and it's a butterfly shape. Next, I'm going to palpate the carotid arteries. Perfect, and those are 2+, and then I'm also going to listen to it with the bell of my stethoscope. And no bruits noted. I'm going to have you take a look that way, and then I'm going to have you take a look that way. No jugular vein distension noted. Next, I'm going to move on to the lung and thoracic. So first, I'm going to inspect respirations. They are regular rate and rhythm, no external use, and no accessory muscle use. The pattern is slow, regular, and quiet with no visible effort. Next, I'm going to inspect the chest shape. I would do this with the clothes off. But I am looking for symmetry. It looks like the chest is symmetrical. I don't notice any masses, no lesions on that chest. No palpitations, no heaves, no deformity is noted. I'm also going to take a look at the bony thorax as well as that spine, and no deformities noted with that. Next, I would palpate for any tenderness or masses. And there is none noted. Next, I'm going to palpate for any pulsations or thrills. I'm going to go to that right intercostal space, that right second intercostal space, the aortic area. Then I'm going to go to that second intercostal space on the left side, the palmate area, and palpate. Then I'm going to go down to the left sternal border, the tricuspid area. I'm going to go to intercostal space 3 through 5. And then I'm going to go to the apex of the heart, that mitral area. And no pulsations or thrills noted with that. Next, I'm going to percuss over the lungs. The lungs should be resonance, and then the cardiac should be dullness. So I'm just going to have you relax. And I'm going to do in a ladder form. And then for resonance, that pitch is going to be low and that quality is going to be howl. And then for cardiac dullness, that pitch is going to be medium to high, and then it's going to be a dull thud for quality. Next, I'm going to auscultate, and I would do this anteriorly and laterally. Take a deep breath in and out. I'm going to go to the lateral side. And then I would also do the other lateral side. His lung sounds are clear bilaterally. No rhonchi wheezes noted. No adventitious sounds heard. Next, I'm going to do my landmarks. So I have the clavicles. I have the costal margins at the costal angle. I'll have you turn this way a little bit. And then I have the exoid process, the sternum, that angle of Louis, the mandibrum, suprasternal notch. We have this supraclavicular, infraclavicular. We have that mid-sternal line. We have the mid-clavicular line. We have the anterior maxillary line. We have that mid-maxillary line, and then that posterior maxillary line. And then we are going to move on to the posterior, so I'll have you come back this way. I am going to, let me come this way a little bit. I'm going to palpate the posterior side of the chest for any masses or tenderness, and there's none noted. And then I'm going to check for thoracic expansion at that 10th rib. So I'm just going to have you take a deep breath in and out. And that thoracic expansion is symmetrical. Next, I'm going to check for CVA tenderness. So let me know if there's any tenderness noted when I do this. Any tenderness? All right. Then next, I'm going to check for diaphragmatic excursion. So what I'm going to have you do is I'm going to have you inhale and then exhale and hold it. And then I'm going to mark it. And then I'm going to have you inhale and hold it. And then I'm going to mark it. So that area needs to be between 3 and 5 inches, and that is in that ballpark. So next I'm going to then also listen to the posterior side. So I'm just going to have you take deep breaths in and out. All right, and then I'm going to, so breath sounds are clear, and then there's no adventitious sounds heard. Next, I'm going to do my landmarks. So I have the 12th rib, and then I have the 7th rib. I have that vertebral lion. I have that scapular lion, and then I have the intrascapular, and then the intrascapular space. And then I have the spinous process, C7 through T1. And then I have the costa vertebral angle. And those are my landmarks on the back. Next, I'm going to do the 3 specialized tests. We're going to do first the whispered pectorally. And so when I do this, every time I put my stethoscope down, I want you to whisper 1, 2, 3. Perfect. And I would do that laterally and anteriorly as well. It is distant and faint. Next, we're going to do the bronchophony, and I'm going to have you say 99. It does not have to be whispered this time.
99, 99, 99, 99, 99, 99.
And it is muffled and distant. And then we're gonna do the ephony, and I'm gonna have you say the E sound.
E, 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 E.
Good. And that sounds good. If it were to be the A sound, then that would be abnormal. Next, we're gonna move to the cardiac portion of the assessment. So first, I'm gonna listen to the 4 areas of the heart. I'm gonna do the aortic area, the pulmonic area, the tricuspid area, and then the mitral area. Perfect. And then I am going to have you lay down. And so we are going to move, I'll have you come this way. We are going to have you lay down. Yep. And first I'm going to check the carotid and then that apical impulse. I'm looking for any pulsations, heaves, or lifts. I don't see any noted. Next I'm going to check for jugular vein distension and for the estimated jugular venous pressure. And for that, I am going to have you put your head up at a 45-degree angle, and I'm going to have you take your head to the left. And so I'm going to look for that highest pulse, that highest pulsation, and I'm going to bring a ruler out. And then I would put another ruler at the sternal notch, and I would measure that. And it is about 2 centimeters, which it needs to be less than 3 centimeters at a 45-degree angle. Next, I'm going to palpate the apical impulse and that apex and the pericardium. And there's no thrills, heaves, or lifts noted. Point of maximal impulse is at the 5th intercostal space, mid-clavicular line. Next, I'm going to percuss the lateral borders of the heart. So I'm going to find the 2nd intercostal space, and then I'm going to go over to the 3rd intercostal space, and I'm going to percuss. And then once I reach dullness, I'm going to mark a line. Then I'm going to go down to the 4th intercostal space. Once I hear dullness, I'm going to mark that line. Then we're going to go to the 5th intercostal space and percuss. And I mark a line, and that would be the borders of the heart. That PMI is not displaced. And then next I'm going to listen to the heart again. I'm going to listen to those 4 areas, the aortic, pulmonic, tricuspid, and the mitral. And I'm going to listen with my diaphragm and my bell. And that is regular S1 and S2. There's no S3 or S4 heard, no splitting, no clicks, no murmurs, no gallops, no friction rubs noted. And then I have the 3 positions. So we would do that upright sitting position, and then we would do the leaning forward position. That leaning forward position is going to bring that heart closer to the chest wall. It's going to help us hear those high pitch and murmur sounds. And then we have that left lateral lying position, and that's going to bring the heart even further to help us hear those low pitch sounds.